rationalism, humanism, and the arts. So I'd like to start off by having you guys introduce yourselves and just telling everybody how you define spirituality, what your spiritual practices are, and how they may or may not have changed or evolved since you started medicine. And then after that, you guys are free to ask questions, and if you guys don't have any, we have some. So.
I'd like to hand it over to you.
Sure.
I was here last.
We'll go. The local.
How do I get it? So, I think a number of you know me already. My name is Jim Blatt. I'm an internist, and I'm on the faculty here. And some of my jobs include being the medical director for the Clinical Skills Standardized Patient Program. I'm also heavily immersed in the revised curriculum, and I do a lot of education sorts of things. I'm a primary care internist, and as I was saying to Jeff earlier, I wasn't totally sure why they asked me to be here, because in certain ways I'm kind of spiritually stunted. But for those of you who have seen me in other venues, you know that I'm very invested in the Reflection Rounds project. We just had a meeting last night, as a matter of fact, I see a number of you here from there. And what it really is it's a chance for people to get together and actually share what's really meaningful in their lives. So my focus on spirituality, actually, I call it, some of you know Dr. Volkowski. I'm going to be totally honest with you. I refer to it sometimes with her as the S word, and she tolerates me. Because I wouldn't ordinarily have used what I think is so important. I wouldn't ordinarily have necessarily used that word to describe it. And meaningfulness is more meaningful to me. And I think my focus has always been to try to be able to make contact with what's meaningful in others and to sort of foster that connection. So that's kind of where I'm coming from. I'm not a member of any religious faith, and I've even flirted with polytheism from time to time. So I'm kind of eclectic, and I think I was brought in basically for diversity. In any case, here I am.
Thank you. My name is Mina Marham, and I guess before starting to introduce myself, I just wanted to appreciate what Dr. Jim here said, because that diversity, I think, is important in this setting, what we're talking about. And my background, I graduated medical school from New Jersey, from Rowan University, and I went on to establish, with some partners, a free mental health clinic in New Jersey. It's Christian-based, provides free services. So my focus has been psychiatry, whether it's through medical school and then thereon. And for me, spirituality kind of evolved over the years. When I was younger, I used to actually think it was, no offense to all the very spiritual people here, I used to think it was just weird, and esoteric and strange and irrelevant almost. I thought to be scientific and super genius, and we're doctors, we're medical people. And I never really found a place for it in my life. And then that really changed my journey through college and med school. And for me, I guess how it changed, how it was defined, it went from being this big general, if you Google spirituality, there's 10,000 ways of looking at it. And one of my friends is doing a PhD paper on spirituality, or dissertation, and she was like, I really can't find a definition, you really just narrow down the definition, because it's kind of hard to find, even though, thank you for opening up the definition for us. For me, spirituality became a person. That's really what it boiled down to. It's the person of Jesus, the man himself. That's spirituality. And when I was looking at the broader definition of the search for the sacred, for me as an Orthodox Christian, that's my background. For us, we believe that sacred is not so much something that's just taking place, let's say, in your worship service, in church, or wherever it may be. It's actually everything that you do, everything you touch. C.S. Lewis once said, you don't meet ordinary people, and you don't encounter ordinary events. There's no ordinary. There's only sacred. So for me, even this moment here, this is a sacred spiritual encounter. This is like a prayer, a doxology kind of, we say in the Orthodox context. I did some studying of seminary and things like that, so that was kind of helped me fine-tune those broad ideas into something more concrete. And I always felt like, specifically in medicine, we are kind of like a great vehicle to merge or to allow patients to see how it all ties in together, from being, you're not just a body, you're not just a spirit, you're not just a mind, you're a whole person. So I'm excited to be here with you guys. Thank you for allowing me to be here.
Thank you very much for those heartfelt introductions, and I'd like to compliment that. My name is Hassan Awan, and in regards to what spirituality means, to me it's important to define words and to be specific. So for me, complementing precisely what everyone else has said on this panel, spirit, I guess in the English Latin root comes from spiritus, which is actually analogous to an Islamic conception of viewing what the spirit is, the spirit being ruh, coming from the word har-ruh, which means capital S, spirit, which is also aligned to ma'ana, or meaning. So it's very interesting that meaning was used, so really the world of meaning. So ruhaniyat, spirituality, which would be the direct analogous term that one would use in Arabic, in Persian, and even in Urdu and Punjabi, and which is my background, it would mean connecting with the world of meaning. And that world precedes in Islamic and really in all sacred teachings this material world, this physical world, so it permeates it. So it's just a very principle, and so it permeates that world. So in a sense, and really in effect, everything is sacred. Everything is spiritual. Everything has meaning. So to the extent that medicine, demonstrates that, to which it should have meaning for one's body, health, healing, well-being, and just being as a human being. How we got here, I don't know if that was asked specifically for this question. My background is being a born Muslim. In regards to how I view spirituality, to religion, and other religions, and even traditional science, I would like to mention that I'm a student, a personal humble student of a professor here at GW, Dr. Sayyid Hussein Nasser. He's a personal teacher of mine, and so practically everything he said on spirituality, I'm in complete agreement with. He has a beautiful chapter called "What is Spirituality," and a recent book called Islam in the Modern World, and that would be helpful for some of you. He's also written on the traditional and spiritual aspects of medicine in other texts and books. So I just wanted to introduce myself that way. I'm a practicing internist in Baltimore. I work around St. Agnes Hospital. I'm also affiliated here, actually, because some of you guys, the students, have rotated at my office in Baltimore, and so I was honored by becoming a clinical associate professor. I'm originally from Maryland, Baltimore, originally from Pakistan. My parents are from there, and I've been practicing now for 7 years in private practice. I also help kind of teach as well at St. Agnes Hospital. I round there as a private physician and also as an attending who teaches. I see nursing home patients as well, and I graduated from St. Paul's School in Maryland. It's a high school, an Episcopalian school, and as well as heading to the University of Maryland at Baltimore County, and then from there to Ross University in the Caribbean, and then from there to York Hospital for internal medicine.
This is very informal. So please go ahead and ask questions if you have any. And there's an exam starting at 9 a.m.
Just FYI. We can just ask you guys questions if you want.
So I have a question. So in your practices, I guess, do there come moments where you guys are obviously very spiritual people, or you find meaning, but a lot of other physicians sort of stray away from that because they feel like it might not be the place of the doctor, in that relationship to talk about something like that. So can you guys think of moments or sort of advice on how to approach something like that if a patient's going through a spiritual crisis or something like that, that they bring to you being a physician, how you sort of approach that situation?
trying to tell me something. In terms of how to approach someone in terms of patience, is it?
Exactly. So if they have some sort of spiritual
Yeah.
crisis or something that this is like something that's come up evidently when you're talking to them.
Yeah.
And it's like sort of how do you navigate between your responsibility as a physician, you don't want to overstep your bounds.
I really think that, in my way of looking at things, that there's a continual struggle between your own personal needs, which are some of which are sort of semi-conscious, and the needs of connecting with and being with someone else. So I think that the challenge is to how to keep your own personal needs under control so that you can free yourself up to be with someone else. I think it's a continual struggle. And the questions for me are, how do you do this? And I don't think I always do it very well. But sometimes I do it well. And in that case, I'm able to be really present for someone, a patient, for example, so that they can really connect in a way that's meaningful to them, and can really develop what they want to develop and talk about what they want to talk about. And I think that I've always done that. I've always been, for some reason, good at doing that. And sort of getting into that groove, I think, is what the challenge is. When I'm talking about distractions, I'm talking about thinking about what you're going to have for dinner. You didn't sleep well the night before. You're thinking about the 15 other patients you have waiting for you, all of which is, creates a certain sort of pressure. And the challenge is, how do you actually deal with that? Don't fight over it, guys.
That's the final word. Well, I would say, in my sense, part of the issue is you began with asking that, or mentioning that, the way we learn medicine, most doctors don't have a spiritual, attitude or a spiritual understanding of things. And so ultimately, to respond to that really has to do with the whole context of how we understand and learn modern medicine. Other forms of medicine, whether alternative medicines or traditional forms of medicines, in the traditional civilizations, from Christian to Buddhist to Muslim to Hindu, were all based on a kind of sacred cosmology. We used this as sacred before, so that cosmology permeated all of existence, meaning, so these sciences were deeply rooted in something just beyond outward modes of treating patients or even understanding health and illness. That there was more rooted in what the meaning of health is, what the meaning of disease is, pathologies, and these sort of things. There wasn't, from a traditional point of view, a reductionist approach to what pathology is, for example, to what they would call reductionist, what we would call like the actual way to look at disease processes. So it kind of starts there. It's kind of how we learn things. It's our worldview actually that informs all of us. So the fact that most physicians may not be spiritual, it's because that aspect of them is not emphasized enough. It's not emphasized in their training, in our training. So everyone up here who's mentioned that they seek meaning, meaning, or they're spiritual, or they're attached to a prophetic or logos figure, and they seek that path. That's kind of purely individual. It's something that we were all inspired towards, guided to. So it's something that each individual has, with a lot of effort, has attempted to kind of bring into their own lives. So that's the first point. So I think what is lacking in many modern institutions that teach medicine is the spiritual element. How can we be present spiritually and in every way for a patient? That aspect. Even beyond the ethical aspect, the ethical norms of medicine. Spirituality isn't taught or acknowledged. So that's a big challenge. I think that any sincere seeker kind of seeks and is faced with. in regards to how to bring that into their, practice. First and foremost, it starts with yourself, so I'll say that much, that one has to try to deeply root that practice and that awareness kind of into your own inner space, so that it can radiate into another space, that sacred encounter between the doctor and the patient.
Thank you.
Could you actually elaborate on that a little bit more and speak to specific instances where you think that your spirituality or faith comes out in like tangible practices, or are you talking more about this just sort of like attitude in approaching your patients?
So mainly attitude, but it comes out in a kind of indirect way. I'm not referring to proselytizing or anything like that, but what I am referring to is again presence, being present to before your patients. So the practice should be rooted in yourself. So one should sincerely follow to what you believe to be a path to God or to ultimate meaning or to ultimate reality. So one should sincerely practice that. Then by virtue of that practice and really by virtue of the virtues being instilled into one's soul, then one becomes kind of a space for others, since that responsibility has been placed upon you, by destiny's hand. The fact that you're doctors, the fact that you're walking into a particular room, the fact that the patient or the person, the human being behind the veil of being a patient, is actually someone who needs your help. So you become of service to them, at that moment. To be present for that means to be as empty as you can, to be as empty as you can before the sacred or ultimate meaning, so that process can occur. That's beyond you, actually. So in that sense, that's the sense I had in mind. As far as specific experiences, there's been multiple. Hundreds, I pray every time, that I see a patient that occurs. More traumatic ones have been, I want to kill myself, like those kinds of experiences where a patient says that, or that I just cheated on my wife, right? So we're talking about, Muslim, non-Muslim, the whole, from my point of view, every to religious adherent, since, medicine is a universal practice. How do you then bring space to allow, recognition of what's happening without first aid judging the person, right? But being there as a service for them, because God wants you to be there from my point of view, right? Or ultimate meaning has you there. And then you have to be a kind of a presence for them, right? And, just to be empty before that process, because healing is beyond just handing a particular pill or prescription to someone. So I would say that there's multiple examples. I could give you one personally, but perhaps after this talk, it could take some time.
For me, I guess there's the general and the personal. I wasn't sure which order to take them, but the general point, I guess I'd agree with everything that was said previously. And historically, medicine was always linked with spirituality. Like from the first recorded physician, Imhotep, I think it was ancient Egypt, who was the first one to actually have a treatise of pathology without magical thinking behind it. The priest and the doctor were always one and the same. It was only recently that we tried to have this separation. And then what's interesting now is evidence-based practice versus how we feel. For example, if I'm not very comfortable taking a surgical history, is that of any practical relevance to how I treat my patients? It doesn't matter what I think I'm comfortable with. It's good care for me to take a surgical history or menstrual history, whatever the case may be. For us now to make an evaluation about spiritual care of patients, is the evidence there showing us that spiritual care is important? Yes, there are 7,000 articles in journals indicating that it's important to take to have the spiritual understanding of where your patients are coming from. So that for me was where I started with this issue of, when it comes to spiritual care of a patient, is this a priority from an outcome, morbidity, mortality perspective? When you see a study that says, I think this was in the Archives of Internal Medicine, that certain patients who are admitted into med-surg or ICU who have significant negative beliefs about God and maybe God is punishing them or abandoning them, things like that, they can have up to a 28% increase in mortality. It's irrelevant how I feel about that, which means it's important. So that's from a general medical perspective. But then specifically, I guess to your question, there are a lot of examples that stick out in my mind as well. Once I take the initiative to introduce a spiritual conversation to let the patient know that your spirituality is important to your care, so that thereby it's important for me as your provider, whether it's in any field of medicine across the board. One patient, once I did create this safe environment where they know that it's important, told me we were just working her up. Her husband was end-stage renal failure, and she was basically fine, but we were just suspecting one particular pathology. And as I walked into the exam room, this was even as a fourth-year student, she just began to sob. She was just crying uncontrollably. I said, well, what's wrong? Mary, we'll call her. She said, I'm going to die. I said, why are you going to die? I don't know, according to this paper here, you're fine. Nothing wrong with you. She said, no, God is punishing me. You don't understand what I did. I did this, and this. All these things that happened to me. And there's no way that God is going to forgive me. God is just angry with me. And this is going to be the cause of my death. And we have to kind of talk about that in a very specific sense. Well, why do you feel that way? Where's your background from? And she revealed to me that her background was actually in Christianity. So I was able to kind of walk her through the fact of, God's love and his forgiveness and how he's not punishing you and he's all those kind of things. And I believe, I couldn't put a case report on it, but I believe that had a significant impact on her, outcome. And I think that's the way it will be for many patients. Sometimes we'll identify a risk by having a spiritual background of a patient. Sometimes we'll just be aware of where they are as a person. And for me personally, the way that, I guess going back to your original question, how when someone comes to you in a crisis, it's like you can just refer. You can just say, well, go speak to your spiritual, and there's a place for referral as well. But I think they confide in us for a reason. And there's a certain platform that we have as medical providers where we're not proselytizing, where we're not shoving our own beliefs on someone else, but we want to use whatever is in their background to be able to help them have a better outcome. And I think that's important and a priority. And still the research shows, I think there was a last study in 2004 that showed no matter how we all nod our heads right now and say this is true, this is very good, 92% of patients say they've never been asked about their spiritual health or their spiritual background from a physician because we're not comfortable with it, as you said. Just because we're not comfortable with it doesn't mean it's not important. Yes.
Have you, each of you ever had instances where your spiritual beliefs have held you back with helping a patient, where they mistrusted you for whatever reason, whatever stereotypical reason? And how would you best handle that? Or how did you handle it and learn from it?
So you're asking whether or not spiritual beliefs ever held me back from helping a patient?
Like, for example, I'm Muslim. If I were to go into clinic and I'm wearing a necklace that says Allah, and a patient were to read that and ask me if I'm Muslim, and I say yes, and they are mistrusting of me because of that, or in your case, for whatever reason, if spirituality or religion came up and you told your patient of your beliefs, and that caused them to mistrust you, how would you best handle that situation?
It's hard for me to answer that because it's really not an issue. My beliefs are centered around making space for someone else, and so that it's not like I bring a particular set of restrictive, beliefs from a particular area or faith or whatever. It's just not, it's not really an issue. It's just never arisen for me as an issue. We all run into patients who we don't particularly care for in one way or another, and I guess what carries you through that is that your feeling of commitment to helping anyone, no matter what their situation is, and no matter what their belief system is, even though that belief system may be very diametrically opposed to what your own belief system is. This is not a faith issue, but it reminds me of a situation when I worked at the VA hospital in San Francisco, where we had to treat a person who had been throwing acid in other people's faces, so that 3 or 4 people were blinded. I wasn't feeling terribly sympathetic towards this person, but we nonetheless treated him. You guys are playing better answers.
It's definitely a good question. And for me, I haven't had many instances where there was a real barrier. If anything, there's often been a time where I feel like my faith has allowed me to have an extra element of compassion or things like that to a patient from a general standpoint. But I guess more specifically, one time that I can think of, or maybe this was once or twice, where my faith was somewhat of a barrier is, it wasn't initiated by me, but one of the patients said to me, come on, do you really believe this Jesus stuff? I was like, well, what Jesus stuff are you talking about in particular? He said, the whole thing, the whole shebang. I said, well, I do believe the Jesus stuff. I think it's a good shebang overall. And the way I approached it, I kind of made a little bit of a joke of it to make the mood a little lighter with the patient, because he kind of knew me. And also, I think from there, I went to dig a little bit deeper. So maybe the approach would be, if someone is uncomfortable by your Allah necklace, it would be a good opportunity, if you're caring for this patient, to explore a little bit of their background. Maybe like for me, I grew up in a Muslim country. I grew up in Egypt. So I have certain baggage or experiences, interacting where I'm very comfortable with Muslim people. Maybe someone who's never seen a Muslim person before could be like, whoa, Allah is whatever, right? So sometimes that's a good opportunity to actually strengthen your relationship with the patient, to see where their preconceived ideas are coming from, and to allow them to see that you're not threatened by an idea that they may have about you.
I'd like to add to those wonderful replies that, in a sense, you have to try to seek meaning in that encounter. So yourself as well. That not only are there is the patient also there for you, you're there for them, and there's meaning from the source of ultimate meaning for you in that encounter. What does it tell you about yourself, right? So first and foremost, that there's something there for you in that possible confrontation, whether that's from how one looks, my long beard or my brown skin, right, my stuttering, to whatever it is, right, to whatever reaction that may cause the patient or anyone else, to whether it's around the time of 9/11. I've had some experiences, around that time when I was a medical student, to even, now to contemporary, to my practice now. To what meaning does that have for me? How can I, understand that? What is God trying to tell me at this point in time for me to learn here? And how can I, uphold this sacred relationship, this sacred responsibility that I have as a doctor, as the one who's serving this particular soul, right? Because they're just not a pathology, they're not a disease, they're a whole human being, a wholeness there, right? So if that ever comes up, those sort of things help to diffuse any reaction that you may be having. So it's important to pay attention to actually, why am I feeling like that? Why am I upset that they've actually asked me about my Allah necklace, right? Why is that? Why do I have to wear an Allah necklace? So what does that mean about me, right? How can I, while wearing that, make an impression on this person that I'm completely like them in so many ways, right? So all of that is pertinent.
Do your question, Mom.
Yeah, I have a question. I wanted to know, considering just the culture of medicine and how there is such a dichotomy between, personal beliefs and what you're allowed to do in the public sphere, how do your colleagues view your outlook and approach to, I guess, incorporating spirituality into the way you practice?
I'm not sure I totally understood the question. Ask it again, please.
Sorry. I guess I want to know how you interact with your colleagues and how they view or judge the different lens that you bring to your care, the way that you seek meaning in your interactions.
Yeah.
Because there just seems to be a dichotomy between doing these things in the public sphere and in the private sphere, and how you interact with patients is usually not seen as somewhere that would be a good forum for that.
Yeah, I actually don't think that, that a lot of us know how other people deal with that. You know, the way we practice tends to be in a room with a patient, and so we don't see each other do that. And it's not particularly discussed. You know, medical things are discussed. I think that was some of the impetus for wanting to put together the whole Reflection Rounds project, where you actually do have a chance to discuss those sorts of things, both as a way to share your way of doing things and to see what other people do, but also to find common meaning, because doctoring is very hard, and it's very sapping in strength, and it's good to have reinforcement for who you are and what you believe in and what you think ought to be done. Is that getting at which? So a lot of times I just don't know what other people are thinking, unless you have a chance to sit down and talk about it.
I would say that situation maybe arises when you are socializing with other doctors, with other physicians. You know, I would say case in point is the doctor's lounge, quote unquote, right, in hospitals, where you do interact with other doctors. I mean, so since I round as well at, at now only one hospital, I enjoy my time in the doctor's lounge. Of course, there's free, very unhealthy food, but apart from that, nice conversation with doctor specialists, friends who colleagues who and so a kind of acceptance. I mean, they see, who I am, I see who they are. We like to joke, and I mean, there isn't a serious conversation about religious beliefs, but that's kind of space for who you are personally, right? Regardless of what that is. So I mean, it's not as already mentioned, it's not really something that's explicitly brought up, right? But again, one has to be able to kind of live your ideals, your beliefs, and your practices.
So I've had some situations where it was very much in the forefront of the conversation, namely because, I'm very passionate about the subject overall, as like some of the people that I'm friends with know. So I've gone to several medical schools where there'll be a similar audience like this, where I would advocate the idea to medical students why it's important to take care spiritually of your patients. Sometimes for medical students, sometimes for practicing professionals. So having that exposure, I've seen two very different kinds of reactions. One, it tends to be from more seasoned professionals. Some of them were surgeons, in my particular experience, who said this is, blasphemy. You could never do this and be an ethical professional. And I said, thank you. I appreciate your input. I just want evidence to support that. For us in the medical world, the gospel is New England Journal of Medicine. So just quote me one of the gospels. So that's been a very real reaction. And there's actually been, I forget the name of the guy, I think his name was Sloan, who was one of the biggest proponents, I guess, of abolishing any intermingling of spirituality in medicine. But again, he's a PhD, and he just didn't have evidence to support his claim. So that being said, that was one very real reaction. The other has been like a liberating one, where a lot of students and medical professionals said, whoa, you mean there's an ethical way that's not only like encouraged by several of these accrediting bodies, including JCAHO and all these other things, where there's a non-threatening way to discuss this with your patients. And for me, the people that I spoke with were all Christians in their background. So they were also happy or excited at the fact that you can speak with the patient and let them know that spirituality is important, and also let them know that it's important to you. And when they felt appropriate, which was often, I've had a lot of experiences where I've prayed with a patient because they asked me to. Or I've had a lot of experiences where a patient asked me for spiritual guidance. Where can I get some more information from the Bible or anything like that? Who is Jesus? Things like that in the exam room. And that wouldn't have happened if I didn't open the door for them to know that spirituality is part of your care. So that's been really exciting. When I see the liberated look on a student's face or on a professional's face, say, I've been looking for this, but I didn't know there was a system. And in the Archives of Family Medicine, they're established the same way that we have mnemonics for every other kind of history that you take, whether it's sexual or surgical or smoking or whatever. There are spiritual history mnemonics as well, and people practice them. As you guys know, I'm sure now, back in the day, that wasn't really incorporated in education in medical schools as far as I know. I'm not that old, but just saying. Yeah.
Can you give an example of how you would bring it up in history, how you would ask
Sure.
about spiritual history?
Sure. So for me, I've always put it as part of the social history. 'Cause it's like once I asked a friend of mine, I said, isn't it weird for us to talk about spiritual things? He said, everything you talk about is weird. So like when I ask an older gentleman if he's having sex with men, women, or both, and he just looks at me like, whoa. So you know what I mean? Like for us, it's normal because we do it all the time. So it's in the social history for me. So once I'm asking about their smoking, their alcohol, their use, all that kind of stuff, I'll incorporate one of the mnemonics. One of them is faith or hope, I think. Where is their HOPE? And you can Google it. It's straight from a journal article. Where do you draw a sense of hope for you? Or the O being, are you involved in any kind of organized religion, or is there any kind of organized spiritual background that you have? Some other mnemonics use questions like, is there anything that you'd want me to know about your spiritual background for your care? Some obvious situations, Jehovah's Witnesses and blood transfusions, Muslims and fasting, Orthodox Christians and fasting, that sort of thing. Those things you want to know, so you wouldn't know unless you ask. So that's the place where I've usually put it, in the middle of the social, and that's what's recommended, I think.
And
Yes.
follow up, what kind of, would it be a complete history where you're getting to know a patient initially? I mean, I feel like a lot of things get left out if it's a focused history, they come in with a sprained wrist or something.
Definitely.
It's hard to know.
Just quick, if you're taking a focus history for someone coming in for a sprained wrist, you're not really going to ask them at that point, about if it's a female, about their menstrual history and things like that, right? So there's a place for it, usually in the first history and physical, that you're just covering a lot of ground. And where it becomes most applicable, apart from acute injury or things like that, are physical crises, like a patient has cancer, a patient is dealing with something, mortality issues. That becomes even more relevant in that setting. So.
Yeah, this comes up a lot, and it's really tricky. If someone comes in for a complete, say, history and physical examination, how do you bring up the issue? And as you pointed out, it can certainly be brought up in the social history. But, how do you make the link, the leap? And one way to do it is to say, in all my patients, I'd like to know a little bit about, wellness, what you do to keep yourself well. Tell me about, diet, tell me about the things that you rely on during tough times. Who are the people that you talk to? Is there any particular tradition or something, or beliefs or things which give your life special meaning during those times? So you bring it up in the context of wellness. And I have to, since Christina Bukowski is based here, I have to mention her FICA mnemonic, which you all have heard of before. But in any case, does that kind of answer the question within the context of just a routine visit? That's one way to bring it up, within the context of wellness.
What's that?
FICA?
We don't know.
You've not heard?
Yes.
I'm so, Christina was supposed to be coming here.
It's faith,
Wow.
importance, community, and space, I think,
Addressing.
interesting.
Yeah. So I'll give you a quick demo on it. Do you have any particular beliefs, or is there anything which gives your life special meaning? That's the F part of it. The I is the importance. What's the importance of that to you? C stands for community. Is there a community of people who you share this with? And the A is, is there any special way that you'd like me to incorporate it into your care when I'm caring for you? Yeah, addressing.
So, if you have a patient who is of a spiritual background that you're not familiar with, how do you prefer to learn about it? Do you prefer to ask the patient directly, or do you prefer to read about it yourself, or ask colleagues who you know?
So first, to briefly respond to some of what was asked already, I would say that also some of that history, as you get to know a patient more, that will become more apparent. It'll just naturally, occur in regards to conversation. So I've noticed that as well. There's many things even in your history and physical, that first day, that you're supposed to be writing down, or you're supposed to know the patient that hasn't expressed, and it just comes later. So part of that is just part and parcel of getting to know a patient. But just being receptive, having that intention of being receptive, for all the needs of the patient, I think is important. If you make that intention, that niya, right, as we say, that intention, God willing, that'll occur. So whatever's needed at that moment for you to be aware of, for the patient to be aware of, it'll happen, and hopefully that'll to facilitate some form of healing on some level for that patient. In regards to what you asked, if you don't mind asking that again, I slightly forgot what you...
One second. If it's 1 o'clock, so if any of you guys have class, you can feel free to leave now. But I think there's nobody coming into this room after, so we can keep going. But just feel free. I don't want to make anyone stay after the things at 1.
Sure.
So I was just asking that if you become a patient with a spiritual background that you're not familiar with yourself, do you prefer to learn more about it by asking the patient directly, or yourself exploring it, or asking colleagues who might be more familiar?
Sure. So I'd respond by saying that it's it's again part of a process. One can get a sense for if the patient's comfortable in revealing their beliefs, kind of in the context of being in a doctor-patient encounter. Most of the time they're free in saying to whatever they want, but many times there's an obstruction. One feels an obstruction. If you sense that, it's important not to prod along. I had recently a Rastafarian who saw me, and so we had a very deeply spiritual conversation, but I never asked him who he was or where he came from, but it just came kind of naturally. We were just talking about something, and it led to another topic, and then we got on the topic. So I tend not to prod that directly. I don't like to ask specifically, but I will ask, on occasion, to what is your spiritual religious affiliation? And like these sort of things, will come up, but I attempt to try to be empty enough to sense the right time for that.
Can I just quickly comment on that also? I really think that everyone's spiritual background is unique. So it's not a question of reading about it, because for example, if you think that every Roman Catholic is against birth control, well, that's just not true. And there's a whole variation within each faith, and I think the way to do it is to ask about it. And I would say you ask about it within context. Just someone comes in, for a chest pain, and it's like, hey, what's your faith? So that. And one way to contextualize it is the wellness context, which I talked about before. But also, when someone has a grave illness, frequently things come up, and you can ask them, what are you thinking about? And you look like you're in a lot of distress. And who do you turn to, or what do you turn to when you've had distress in the past? And that's what opens it up. If the person wants to talk about it, they've had the invitation to talk about it at that time. If they don't want to, they won't do it.
I'd agree there as well. I just wanted to add, sometimes if it's, like I've had one patient that comes to mind right now who told me, when I asked him about his spiritual background, he said, I worship ancient aliens. I said, that sounds cool. I'd have to Google that. I'm not familiar with that particular belief. So sometimes when you get something totally that you've just never heard of, I think it would serve your patient well if you have somewhat of a background from it. But besides from that, the other point I'd agree there as well is like not making an assumption when you have a patient who's from the Abrahamic religions that they necessarily subscribe to everything that's in the faith. I've had a lot of patients where I was very surprised in terms of what they actually practice versus what they were brought up in. And they appreciated when I took the time to get to know them as a person, not just as a religious label. Oh, you are so-and-so, that means you are such and such. No, you're a person, you're an individual. So I don't know how to pick. It's up to you guys.
One?
Do you feel well equipped to be a sort of because we've talked about the sort of clinical aspect of care as well as the spiritual aspect, and there's almost this assumption, I guess, that we are able to address both those sides of a patient. Do you feel well equipped to provide a sort of spiritual nurturing as well, or do you also, in this case, refer to a specialist, as in find where that community is and where they find that spiritual strength from, and send them to the pastor, rabbi, priest, whatever? And And also, what do you do with that information? Once you know what their spirituality, the patient's spirituality is, like, of course, if you're, I guess there are parts of it that can be incorporated into like hard and fast, like, okay, you can't do, blood transfusion. But in general, like, what do you do with that information? Like, is it just to build rapport with your patient? How do you,
Well, I'd say, first and foremost, it's important to kind of know who you are and what you represent for that person, and first and foremost, who you are in yourself. Not being a spiritual authority really on anything, speaking for myself, I cannot have any spiritual guidance per se. If a patient asks me something, right, in regards to spiritual matters, then I'll express what comes, from my heart. But it's important, as a physician, that first and foremost, that they're here to see me as a doctor, right, as their doctor, that is, like the relationship that they have, that they're not here to see me, as their priest, their imam, any kind of cleric of any sort, or anyone with a particular religious or spiritual authority. The authority is only, kind of in as much as they're recognizing that you have some form of knowledge and authority from a medical point of view. So it's important to kind of have that in context. However, as we've been mentioning here, medicine has, everything to do with spirituality as well, right? But those lines are very important. Sometimes, I'm asked to pray for somebody. Sometimes, I'm asked for specific advice. There was a dying patient, for example, at the University Hospital, my patient who asked me to see him, he had doubts about Christ. Now, he was about to die. He's a, he's a Christian, a Catholic. He had doubts about his faith. He asked me something very particular in the history of his faith, right? And so I searched my own heart. At that point, I'm a Muslim as well. And, am I supposed to now assert a particular creedal, belief that's, that is, that's, against the belief of another person, right, or not? And at that point, since I had some knowledge of, other religions, I've studied them, I gave him a spiritual understanding of that particular aspect of his faith. That restored his faith at that moment. He healed and he actually moved on. He's all right. Here's a guy who had lung toxicity from chemotherapy, that was on an ECMO machine for months, comes off it, is delusional, then depressed, and has a history of bipolar, and really wanted to kill himself. Kind of at one point, how come I'm in this situation? And then he asked me that. So I provided him some understanding of the crucifixion and these sort of things. And then I just mentioned that if you needed any resources, please let me know. I can, refer you to certain works or certain people, from that point of view. So it's a matter of, but I believe in all of that. I was his doctor. That I did what I needed to do, what God willed me to do at that moment for him. And that is in light of me being a Muslim, right? So that's just one example.
I can start. To answer, I guess, more globally, the literature shows that physicians across the board are not equipped. Like when they're asked, do you feel ready? Do you feel like you could give any kind of spiritual support to a patient? I think it was 75% in that one article I read. It said that they were not. And the reasons were numerous. Some just said they were never trained well. Some said they were uncomfortable. Some said they wouldn't know what to do with the information once they got it, like you said in the second half of the question. So that's generally speaking. And for me, I felt that same way. And thank God I had the influence around me when I was in school, in medical school, to say, well, if you feel unequipped, well, do something about it. The same way if I'm not very well equipped in, a particular subject in medicine, I'll study more, I'll get more experience, I'll shadow someone. So I feel much more equipped now than I did, 7 years ago or whatever. But that's just been a product of recognizing that I'm not equipped and saying, well, I have to put in extra work, I have to find more resources, and there are plenty of resources. I have to find more time to practice, the same way I do, the history and physical in general. And that really helped me personally become more equipped, become more comfortable. And your second question of what to do with the information once you get it, it's the same thing as you would with other parts of the history. Sometimes you just put away something as, okay, they're a smoker right now and they're not interested in quitting at all. And you just put that in and it goes in for later. It may not affect their care at this very moment, but sometimes, again, from like the literature, sometimes you identify a risk factor that you want to be aware of, you want to put in the back of your mind, this patient has this particular background and they feel this particular way and that could affect their care. Or sometimes you identify something that could really help them. So document will be the first thing. You want to document, you want to think about how can I use this, like the A in the FICA mnemonic, to augment and to apply this to their spiritual care.
I actually don't have anything to add. You had another question?
My question was, so I find that spirituality, the more time you devote to it, the more it grows and the easier it is to see these spiritual encounters that we've been discussing. So my question for you is, how were you able to kind of incorporate that time during medical school, during residency, and even as physicians today, aside from, of course, prioritization, but also considering the fact that even going through medical school can be a spiritual journey on its own. So just your viewpoints on that.
Would you like to? So I would mention, of course, that's a very personal question, but in as much as that may help some students here, or hopefully everyone, I'd like to somewhat respond in service. You're absolutely right. I feel that spirituality is something that grows. I feel I've always been a spiritual person, but I didn't know what that really was, to what spirituality was before. I always sought meaning in things, in the religious forms I practiced, and these sort of things from a young age. But then when I started recognizing what this is, I attempted to practice it. As far as medical school, and then thereafter residency, and then your practice, certainly that's a challenge, because you have to devote so much time and energy to studying, to reading, to memorizing, to applying, right? That space for a kind of inner spiritual growth and even psychological growth is stunted, apparently, by the lack. By the sense of being constricted by the need, by academic pursuits and by professional pursuits. What I found helpful is attempting to root yourself in practice, consistently, not just purely on a spiritual level, but I would say also on a physical level. That you as a human being consist of body, mind, soul, and spirit from multiple cosmological points of view, from multiple religions. So each one of these has to be nourished, if you will. So physical exercise, but exercise in a sense rooted, in some form of contemplativity. So I'd recommend hatha yoga exercises or something like that on that level, right? Then psychologically, those who are attached to the Islamic forum, to Islam or Christianity or any religion, to attempt to practice the canonical rites, the outward rites, right? Of the religion, but then to supplement that with personal kind of inner spiritual practices. So whether that is meditation, right? You wouldn't believe what even 5 minutes of actually meditation would do a day. Kind of in the midst of really the whirlwind and storm of in modern societies and modern education, right? So allowing that to implant itself kind of in your soul, finding space, making space rather in your soul for that, is extremely important. There's certain times, obviously in residency, I attempted even before residency to stick to very strict practices, apart from the 5 times a day, daily prayers, other prayers, other modes of invocation and meditation, spaced out 2 to 3 times a day. That obviously became a challenge, especially in residency, which of course was then essentialized a bit more. But coming out of residency, those practices have become, even more kind of rooted in me, since now I have more control, in a sense, of my time and just my professional kind of schedule. So I've kind of integrated it into my schedule. So over the years, it's expanded. But it could not have expanded to where it is now, and God willing, more in the future, had it not been for the intention of actually, continuing to be consistent in some form of practice, to consistently maintain space, to have a center, right? Like, and to build from that center. So I would say that much for now.
Okay. Similar, I guess, as well, but for me, the same challenges were in medical school, time constraints and things like that. The single biggest element, if there was one thing I could put my finger on, that allowed me to have kind of a spiritual growth in the midst of having no time, was releasing like the compartments of my life. Like I always thought, okay, 10 to 2 or whatever, this is study time, this is prayer time, this is Bible time, this is whatever time. And going kind of full circle from the beginning when we define spirituality as a person. For me, since spiritual things are connecting with the person of Jesus, I can do that at all. Like, I should be doing that. I have the opportunity to do that all the time. The same way that I have the opportunity to do that when I'm alone in my room, I have the opportunity to do it in a room full of other people. Like I was listening to a podcast on the way here, a 60 minutes interview with these monks from Mount Athos, somewhere in Greece. And they asked the monk, they said, you guys you say that you pray without ceasing, you pray all the time. That's supposed to be your aim here. And the monk said, yeah, that's what we strive for. We strive to be in prayer all the time. The interviewer said, are you praying right now? He said, of course. I said, well, you should pay attention. That's what the interviewer said to him. But he said, no, I mean, even in an interview. So for me, how this made sense practically was, I'm sitting here with, a Golion book, and I'm learning pathology, but okay, I'm connecting with Christ because he created the human. He created the whole thing behind what I'm studying, and I'm thinking, I'm learning pharm, and I'm thanking God for the ability to have treatments for these awful diseases. That kind of thing, just being mindful of where I am, and again, because the goal being not just a shell of an external thing, but an internal connection with a person. And that made all the difference in the world for me. And then going a step further was, like, I'll tell you again, for me personally, this may not apply to anyone else, but I used to have my own internal dichotomy of like, why am I in medicine? I should just go be a priest. I should just go do spiritual things because those things matter more, and maybe others have felt the same of, I should just be an imam. I should just be whatever. Those things are more directly spiritual. Then I came to realize, like, the more I understood my role this is as if I'm going through seminary. Medical school was almost a seminary training and the equivalent thereof in any other faith. The more I realized my role here is a spiritual role. And because there's no non-spiritual role, in other words. Like we said before, there is no non-sacred, there's no non-spiritual. Once I understood that more, and I realized that what I'm doing has a lot more value and has a lot more opportunity to meet Christ in it.
Yeah, well, and sort of as your diversity panelist here, not being affiliated with a religious tradition and never praying, it's I think still very possible. I think it's that I would do it through community, through connecting with people who are like-minded and who meaning can be explored with. I mean, I don't think you have to pray or be part of a religious tradition in order to find meaning in one's existence and in one's life. And I wound up doing that throughout medical school, finding other people who I could speak with about this kind of thing. And I guess I'm still bringing forward that tradition because of the reflection groups that we have put together now and that we've done with third-year medical students and that we will continue to do in the revised curriculum. Yes?
I was just wondering, at what point when you're talking to someone, especially when you're talking to someone in the hospital, would you try to feel the spiritual question? At what point would you call in chaplaincy? And how do you balance that for both your patients and for your health as well?
And what was the last part?
I think that it's also sometimes, it can be very stressful to talk about that is not the religion that you need, and you have someone, especially someone who is having some sort of a crisis. How do you balance your role as a physician, trying to give spiritual guidance, and then at what point do you also connect, and do you just try it yourself, do you bring in chaplaincy, or do you try to do a mixture of those?
Yeah, I mean, I think it's like lots of things in medicine. There are areas that you don't have expertise in, and you know that you have to get outside help with. And I think it depends upon your degree of expertise. I think our mission basically is to kind of prevent or to address suffering. And that suffering could be biological and it could be emotional and it could be spiritual. And if you are not feeling equipped to deal with the spiritual part of it, there are lots of people out there who are. And that's when you would bring in a chaplain. And especially those who have been specially trained and certified, they're very skilled at doing that kind of thing. So I think our major mission is to see if there is a spiritual crisis, and then to make that diagnosis in effect, and then to bring in someone who knows how to deal with it if you don't feel comfortable dealing with it yourself.
I would agree as well. And I guess continuing with the medical analogy, if you're managing a patient in the hospital, you can't refer everything, right? Like, even though you're not a specialist, you may not be the cardiothoracic surgeon, but there's a certain degree of expectation of you as a medical provider that you have, at least you know a little bit about what needs to be known about. So unfortunately, there isn't an algorithm. If you were managing an acute MI or something, there's a particular point in which you're not going to be the one to stent the person, right? Or if you're the primary care. There isn't as much for the spiritual care, but again, going from the global scene, usually what we err on the side of doing nothing. That's what most physicians do, is not address the spiritual care at all. We're not having like an epidemic of too much chaplaincy referrals, right? So I guess when in doubt, chaplaincy referral is better than not addressing the patient's need at all. But oftentimes, and I think my colleagues would agree, that the patient oftentimes, he can ask for a chaplain. He or she can ask for a chaplain. But sometimes they bring it up to you because there's that ongoing relationship that you have. And they want you at least to be a part of the situation. And you may not have to do a whole lot. It may not take a whole lot of time. But just letting the patient know that you are empathetic with them. You understand where they're coming from. And you want to be there for them. Even by saying those words and saying, you know what, maybe we can even bring someone else to help us along in this process. That can go a long way in their care.
Very nice. I don't have much to add to what the both of you had said. I would just say that, again, just kind of being there for the patient, oftentimes the patient, it means a lot for them to hear something spiritual coming out of a doctor's mouth. It just means a lot. So to be able to facilitate that process, they will ask also about, if they want a chaplain and these sort of things. So there's, many cases, from my own personal context, since I also work at a Catholic hospital, the chaplaincy is always present, and you'll have a chaplain who will come by to practically every patient and ask if they have any needs. But really, timing is important here. Timing is important. That moment is really when you recognize that there's a need. Just as we recognize, okay, we need an orthopedic surgeon or something like that. That recognition is very important. That's your responsibility in a sense, as a physician, to be able to facilitate that. So to have that conversation, it first starts with making space kind of in yourself. Then having that conversation when the opportunity, affords it or provides it. Then making like the right phone calls or, the referrals, or if the patient is comfortable with you, then with you, right? But the more help in this category, in this department, the merrier. It's, like the spirits is, ever expansive, right? So the wind, bloweth where it listeth, right? So, so the more help, the better in this regard.
Yes. So earlier we were discussing meaningfulness in the context of spirituality. I think something that many of us struggle with is the meaning of illness and suffering. And I was wondering if you could share how your experiences and beliefs have shaped your ideas of what it means to suffer.
The meaning of suffering. As far as I'm concerned, suffering has no meaning. I don't understand it. I don't think it should exist. And I think that my job is to do everything possible to fight it. I remember as a college student, I read Camus' The Plague, and it sort of puts forward that point of view in a kind of existentialist sort of way. Suffering, as far as I'm concerned, has no meaning. whatsoever, and that we should do everything possible to help each other through it.
I would add that from my perspective, actually suffering has a lot of meaning. That both wellness, health, happiness, and suffering have meaning, and they have meaning to the extent that they bring more meaning into your life at that moment. So in a sense, as we're taught in our tradition, both health, wellness, and illness are blessings from God. But we have to, even if outwardly, apparently, a particular illness causes much suffering, there is an inner good in that, perhaps for you. So finding meaning in that experience, finding meaning in that pain, right, in that suffering. Why am I in pain? Why am I suffering? Why is this? Sometimes that can lead to other very bad doubts or very bad thoughts or pathological thoughts. However, it's also a window of opportunity into yourself at that moment. So to find meaning actually in your health, your well-being when you are healthy, and to find meaning to when you're not well, when you're on the verge of becoming sick, then actually being sick or having a terminal illness. How many patients have we all met, especially the practitioners here, who have had either pancreatic cancer or anything like that, but you've seen kind of a process of healing in them, even if they die from it 1 year later, 2 years later. There's kind of profound healing that they have, saying that I've been able to speak to all my family members, all my friends, I've forgiven them, they've forgiven me. This was an opportunity for me to turn things around, these sort of things. If that occurs, then they've healed on a level beyond the formal kind of physical level. And that is real healing. And that's where meaning is found in suffering. So it's an opportunity actually for ourselves when we're healthy to counter blessings, and then when we're not well, when we're sick, when we're suffering, to recognize and first of all accept it. Accept that this is, in a sense, we're the hands of destiny, we're reality, where God wants me to be exactly. And then from that, to facilitate a form of healing that may be outward, meaning physical, and it may not be, but at the least and at the most, it'll be hopefully, God willing, spiritual healing.
So I would just add 2 quick points, just to be brief. From the Christian tradition, one, in terms of the origin of suffering, we understand suffering as a defect in the human condition, that it has no place in the human. It was never intended to be part of our nature. It was only a part of our nature once we had that separation from God and brokenness entered the world as we know it. That's as a simple side point from where suffering comes from. But secondly, maybe more pertinent of how we make sense of suffering, I guess the one unique element in the Christian tradition, we say the one super controversial thing, which is difficult for a lot of other faiths to say, is that God suffered. God in Christ came into the world and actually suffered. And by suffering, he changed the meaning of suffering, or he gave suffering meaning. What does that mean? Right now, I guess in a very practical sense, we will all suffer. It's just a matter of how we choose to live that suffering, and either for our patients or ourselves. And from the Christian tradition, there are 2 ways of looking at it. Either there's Christ-like suffering, in which your suffering can actually bring life to yourself and to others around you, or you can rob yourself of that and have your suffering be of no meaning, no value, no consequence. But for us, the big difference or the big change that happened in our history was when God himself, like the impassible, we say, or the one that could never suffer, actually became a person and suffered, to change suffering altogether. I don't know if that helps, but that's just kind of...
I think we've lost a bunch of people already, but I'd just like to thank our panelists for coming from far away and near and far away to share with us their experiences. I know this is something that I was really looking forward to, and I hope you guys also learned a lot from it. I know I did. That said, I think there's more pizza and stuff. If you guys would like to take some, please do, because we're not going to do it all. But if you can, thank you to the panelists, and also thank you guys for coming out, because obviously, we had a really great audience and a lot of good questions. So.